Hello and welcome to Health Digest, the program that brings to you news, analysis, development, and everything that concerns your well-being. I'm Ogom Ezidimbu. Today we are shining a spotlight on a topic that doesn't get enough attention, yes, and that is childhood cancer. And while cancer is often seen as a disease of adulthood, it is important to acknowledge that children are to face this life-threatening condition. But how prepared is Nigeria's healthcare system to handle childhood cancers? What should parents and caregivers know to safeguard their children's health? All of these and more we shall be discussing. But first, let's bring you our health news.
Nigerians have been told to avoid all but essential travels to Uganda and other countries with confirmed Ebola virus disease cases. This came after Uganda's Ministry of Health confirmed the outbreak of the Sudan strain of Ebola virus disease in Wakiso, Mukunu, and Mbala City. So far, one case has been recorded, resulting in one death, with 44 contacts currently under surveillance. The Director General of the Nigeria Center for Disease Control and Prevention, Jide Idris, said, while Nigeria has no recorded cases, the agency is reinforcing surveillance at entry point, updating emergency response plans, and expanding diagnostic capacity in key laboratories. In his travel advisory, the DG noted that while the World Health Organization has not imposed travel restrictions on Uganda, anyone returning from affected areas within the last 21 days who develops fever, muscle pain, sore throat, diarrhea, vomiting, stomach pain, or unexplained bleeding should immediately call 6232 or the State Health Hotline for assessment. The National Health Insurance Authority has increased capitation, a fixed annual payment to healthcare providers per enrolled patient by 93% and fee for service by 378%. This adjustment, which aims to incentivize healthcare providers and improve service delivery, follows an initial increase made 6 months ago, a 60% increase in capitation fees and 40% increase in the fee for service payment. Director General of the NHIA, Kelechi Ohiri, announced the development at a stakeholders meeting with HMOs and healthcare providers in Abuja. He noted that the new tariff approved by the Coordinating Minister of Health and Social Welfare, Ali Pate, was introduced as a temporary measure to stabilize the industry and manage rising costs while awaiting a full actuarial review to establish sustainable rates. The Nigerian government has launched the National Strategic Plan of Action on Cholera Control 2025 to 2029. It's a comprehensive operational plan developed through a multi-sectoral approach to eliminate cholera as a public health threat. This initiative, which aligns with the Global Task Force on Cholera Control, aims to reduce global cholera deaths by 90% and eliminate the disease in at least 20 countries, including Nigeria. The launch, held on Tuesday in Abuja, was organized by the Nigeria Center for Disease Control and Prevention in collaboration with the Federal Ministries of Environment, Water Resources and Sanitation, Health and Social Welfare, and the Global Task Force on Cholera Control. The Minister of Health, Professor Ali Pate, represented by the Permanent Secretary Daju Kachulam, emphasized the importance of collaboration in tackling the challenge posed by cholera. She highlighted that eliminating cholera requires a multi-sectoral approach with all stakeholders working in synergy to implement effective interventions. The Nigerian government is exploring a unique approach to cancer care through health insurance coverage for cancers in accordance with the National Health Insurance Authority (NHIA) Act 2022. It has immunized over 12 million girls against cervical cancer, according to the Minister of State for Health and Social Welfare. The minister noted that NHIA developed a robust concept note and implementation plan for catastrophic health insurance (CHI) that would support patients with end-stage renal diseases, cancers and sickle cells, adding that the CHI would benefit from the Basic Healthcare Provision Fund and other funding mechanisms within the NHIA. It is set to commission 3 of the 6 new cancer centers being upgraded with new radiotherapy and nuclear medicine facilities in May 2025, while the remaining 3 were built to be commissioned on or before the 2026 World Cancer Day. Minister of State for Health disclosed at the briefing to mark World Cancer Day in Abuja that the Bola Tinubu government intends to sustain the initiative throughout its tenure so that before 2030, every part of the country would have been equipped to treat all forms of cancer. He disclosed the move as a unique strategy to attain the global target of the World Health Organization (WHO) to eliminate cervical cancer and other preventable cancers by the year 2030. The minister also observed that the government was working to improve access to cancer care services in all the federal tertiary health institutions for prompt diagnosis and comprehensive treatment. That is it on Health News Today.
Childhood cancer may not be as common as adult cancer, but it remains a devastating health challenge. And to better understand this issue, our guest is Dr. Ozi Okonukwa, Head of Management of CACPI Children Cancer Foundation. Welcome to Health Digest.
Thank you for having me.
Before now, we don't usually hear foundations coming up, road walk and all of that, talking about childhood cancer. But we're beginning to see this almost not just on World Cancer Day, even during the year. Are we having high cases?
Yes. We're beginning to record more cases of children coming down with cancer. And this is also because of the increase in awareness.
Okay.
Before now, most persons did not even know that children can have cancer. And so a lot of people who had cancers in childhood were misdiagnosed, mismanaged, or they were never reported. And this had continued for such a long time until it became apparent that there's a need to step up work in terms of creating awareness and sensitizing the general public about the prevalence of cancers in children. And that's what, the foundation has been doing. Way beyond just doing walks, we actually intervene in the lives of these children. And it might surprise you to know that most wards for treating children with cancer are actually loaded with a lot of children. If you go to the pediatric ward, in the oncology ward, in some hospitals that manage cancer, you see the number of children who are being treated for cancer. And that's just a minute number because a lot of them don't even come to the hospitals.
So what kind of cancer do they have?
They have basically every cancer that adults have, except from prostate cancer and maybe to a certain extent breast cancer. They have brain cancers of the brain, cancer of the blood, cancer of the liver, cancer of the kidney, cancer of the bone. They have every cancer except, specifically prostate cancer and maybe, breast cancer. So every cancer that adults, report, children also have it.
But we often say that to prevent cancer, if you don't want to come down with cancer, you have to live a healthy lifestyle. You have to eat balanced diet. You have to go for exercise. But these are children.
Yep.
So what's happening?
Now, that's an interesting part, of cancers in children. You have lifestyle changes, you have dietary changes, you have, healthy habits that you can form to avoid cancers, in adults. For instance, if you don't smoke, the risk of you contracting lung cancer, for instance, becomes very slim. Now, a child does not have anything to do to prevent cancer. There's no prevention, and there's also no screening that you can do to detect these cancers early. You know, you said women should go for cervical cancer screening so they can know whether they have cancers or not, and if they have it, you detect it early. Now, there's no way you can send a child to go and screen for brain cancer. So it is more interesting that cancers in children cannot be screened or detected, early enough. So there's no way you would know whether a 2-year-old child is going to have cancer. The only thing that may give you a little inkling whether this child would have cancer or not is if there's a history of cancers in the family.
Okay.
That's the only thing. If not, and trust me, it happens to anybody, whether there's history or no history, chances of having cancers in children is quite high. Now, statistics shows that about 400,000 children annually come down with cancer.
In Nigeria or the world?
Globally.
Or globally.
Now,
okay.
This number is higher in developing countries like Nigeria. It will also interest you to know that while survival rate of children with cancers in developed economies is 80%, in low and medium income countries like Nigeria, survival rate is 20%.
So what could be that?
Well, a lot of factors, contribute. A lot of
that we don't do, like you earlier mentioned about misdiagnosis and mismanagement. So that we don't have our lab or our diagnostic system is not okay.
I'm not going to lay
because we only
blame.
talk about early detection.
Now there are two factors here. One is late presentation. We're talking about early detection. If you don't present a child early, there's no way you're going to detect early whether this child has cancer or not. And we all know that the earlier you present for treatment, the better your chances of getting, remedied. Now, so you have a lot of children who don't come early. Now, that if you couple that with the lack of access to healthcare, especially in the rural areas, where there's no access to qualified personnel, and then also to access to, equipment to help detect these ailments. So these ailments progresses for a long time before they are presented in the clinic for treatment. And doctors are not magicians. If you don't come early, chances of getting good treatment becomes very slim. So the factors that contribute to this alarming number or poor survival rate, one is cultural, implication. A child who has cancer, the parents believe that, it is the will of God. So there's nothing that is going to be done. And then they'll also forget this, it is not my portion syndrome. I bet you, as we are talking about cancers now, people who are watching and say, no, it's not my portion. It's not going to happen to me. There's nobody that has been destined to have cancer. There's no person who is qualified, as it were, to have cancer. It can happen to just anybody. Christian, Muslim, rich, poor. Your political parties makes no difference. So there's no reason to say, okay, it's not going to happen to me, and so you just wave it off. Information is knowledge. Now, what are the things that parents need to look out for, really, if you want to, prevent this thing early? Now, you have some children who keep coming down with fever. You treat for malaria today, it doesn't get better. You treat for typhoid tomorrow, there's still this fever. If you have an unresolved fever in a child between 0 and 14, please send that child to another qualified specialist to have another look. Now, if the doctor who is managing your case is not wise enough to refer you, now with this information at your fingertips, you've been treating malaria, typhoid fever, any kind of fever you've been treating for 2 months and it doesn't get resolved. I'm just using 2 months, it's not a scientific data. If you've treated for so long and this condition is not being resolved, and you're sure that you're not constantly exposing this child to malaria parasites, for instance, then please send that child to go and see an oncologist. Now, you don't lose anything if at the end of the day the oncologist says, oh, sorry, you don't have cancer. You go home, you feel better, and then you now intensify your treatment. So if a child is constantly being treated for fever and it's not getting resolved, it could be a sign that this child, has, cancer. Especially if this child is between the ages of 0 and 14, like I did mention. Now, again, if a child has a swelling somewhere that, appears to be constantly unresolved, you take every form of anti-inflammatory, it doesn't go down, whether it could be in the leg, could be in the stomach, it could be anywhere, please send that child also for more evaluation. And, you know, sometimes you have children complaining of constant headache. Now, this for a child who can articulate and, you know, describe, you know, his or her condition. A child who is 2, 1, will not be able to tell you that, hey, mommy, daddy, I have a headache. So it is up to you to be very observant to tell that this is becoming really uncomfortable for this baby. But if a child is always complaining about headache, it could be a sign. I'm not saying that these are definitive, yes, but it's just, you know, a sign that, look, you need to evaluate this child more so that you can actually rule out the presence or the absence, you know, of cancer. There are a couple of other, you know, symptoms that a child may be manifest. A child who is unnecessarily tired is not able to exert any physical activity, suddenly falls tired, is very weak and sickly. Now, most parents will definitely present such children, you know, but these are just some little signs you can observe, and then you send the child for more evaluation in the hospital.
You manage some of these children. How do they present? Do they present late? Do we have late presentation more in Nigeria?
80% of the time they present late, and even some of them abandon treatment halfway.
Okay, so that brings us, how accessible is cancer treatment in Nigeria for children?
Very, very expensive. And you even have, the oncologists are few in number. And they are overwhelmed, you know, by the number of patients that they have to attend to. So we have shortage of personnel to handle these cases. And if you juxtapose that with the fact that children who have these cancers always present late, you understand, and then they can't even afford treatment. So it's actually very difficult and draining, both emotionally and physically, to manage these children. If I tell you that, let us say 8 out of 10 patients that come for cancer treatment end up dying, if we use the percentage that is globally ascribed to low and medium income countries like Nigeria, where we say 80%, you know, survival rate is 20%. That means of every 10 children that come to the hospital, only 2 will likely survive. And you cannot rule out late presentation as a causative factor. Again, the type of medications that they've been using before they come, you know, there is so much reliance on self-medication. So there's a lot of work that needs to be done by every person who is involved in this space.
So talking about accessibility, we understand that the NHIS is doing a little, you know, to alleviate the sufferings of cancer patients. Do we have children involved in all of that?
You know, there's something about bureaucracy, paperwork, and government policies. You know, you hear so much fanfare when these policies are launched, you know, oh, it's going to take away the problem of everybody. By the time it trickles down to the child, you know, from Mararaba or the child from Gwagwalada, you know, you're talking about 6, 7 years or 8 years down the line. And that child is not going to wait. The ailment is not going to stop until your intervention comes into play. As of today, from my own practical experience, I have really not seen a child who has benefited from the insurance scheme. The government tried to bring in cancer relief fund, you know, to support these children. Now, you will agree with me that childhood cancer is the least mentioned cancers in Nigeria. Now, that tells you that even from the planning stage, childhood cancer was not incorporated, you know, as a main issue. It was like an afterthought. Oh, truly, there are children who have cancer. So they now started looking at how to, you know, provide succor to these children. So truth be told, children who are, you know, really suffering from cancer have not benefited from any level of intervention. It is mostly non-governmental organizations that are doing all of this. Like what you do? Yes. You know, we have taken it as a priority to provide support free of charge to children who are being treated for cancer in Federal Medical Center, Jabi, University of Abuja Teaching Hospital, Gwagwalada, and National Hospital, Abuja. Every child that is referred to us gets free access to both diagnostic and therapeutic, you know, interventions from these 3 facilities, as long as they are referred by the consultants who are managing these children. So we have seen that children are dying, and we are losing some vibrant children, intelligent, beautiful children to cancer. And why? The parents cannot afford. I mentioned earlier on that there's a lot of treatment abandonment. A mother is coming to the hospital with her child every other week to receive care. She's going to pay transportation. She's going to feed. she probably has dropped out from work because for her to take care of that child, she can't afford to be going to work anymore. So her income source has dried up. And she keeps coming, and the treatment is not as if it's 1 naira, 2 naira. At some point, she backs out. And what is the fate of this child? Sometimes they now use one herbal medicine, or they go to churches, to mosques to start praying, or to one spiritualist. Next thing you hear that the child has passed on. But we looked at all of those and said, no, there must be a way.
Oh, yeah.
And we said, okay, instead of abandonment, let's see how we can spread resources amongst all of these children. We started off with National Hospital, expanded to University of Virginia Teaching Hospital, and now to Federal Medical Center, at least to see how we can just save, one life or two. And I think so far we've been able to record a few success stories.
Well, thank you very much for that. So, but what steps should government take in this regard?
The challenge I have with government is the bottlenecks and the bureaucracy. We've been shouting for as long as I can recall that government should pay attention to childhood cancer. Why am I saying this? An adult who has lived, I'm not discounting rather, well, whatever. I'm not, downplaying the impact of cancer as an adult. But a child has a longer lifespan, to live. So you just pluck out this child's life who has not even experienced, what life is all about, between the ages of 0 to 14, 15, you lose children at that. It's really not fair. Government should look at this as a priority and not this, knee-jerk responses that we're currently providing for children who are suffering from cancer. I believe that this government can afford to provide treatment for cancer for children free of charge. There was a time, I know some state governments started this health policy of 0 to 5 treatment for children between the ages of 0 to 5 free of charge. Cancer was not included. But we can escalate this to children who are suffering from cancer and see how we can, provide, some level of intervention. If we cannot completely fund it, let's even subsidize, this treatment for these children. The National Health Insurance Scheme may capture only the organized public or private sector. The woman who is selling akara in Gwagwalada does not have access to health insurance. So, and if her child has cancer, what's her chances of getting, treatments? So we should just subsidize it, at the hospital level and make sure that every child that comes in gets, if you can't completely fund it, at least let there be some subsidy,
Are there any form of private sector support?
Not that I'm aware of. Just pockets of individuals coming in, chipping
like
in.
An individual thing, kind of?
Yes, bringing in their token here to see what they can do. I know, for instance, the Lions Club is doing the bit that they can do because they have a policy on childhood cancer as well. So apart from that, I'm not too sure I know of anything that is looking at childhood cancer as a priority or as a policy, rather.
Well, so from what we have heard, childhood cancer is not just a medical issue, it is a societal challenge. Before I let you go, Doctor, maybe you just give us your last word.
What I would say as my parting shot is that Nigerians should not wait until the disease has ravaged the whole system before seeking help. The earlier, you take a child for examination, the better. We should improve on our health-seeking behavior. Seek help not just when you're ill. And I'm saying this broadly, not just for childhood cancer alone. Do not wait until you're ill. You take your car every weekend to go to the mechanic for servicing. When last did anybody go for a regular, just a routine health check? It is important that as a policy, while we're making our New Year resolutions, we should also include that this year I'm going to walk into the doctor's office and have myself examined whether or not I am ill. Sometimes, if we look at the definition of health according to WHO, it says clearly that the absence of disease in your body or illness doesn't mean you are healthy. Yeah, so you must not wait until somebody pronounces you sick before you go and check whether you are or not. So the value of a clean bill of health is much more than the value of the naira that you are going to spend in assessing healthcare. We do not know the value of health until we walk into the hospital and see persons who are lying down there because they never came early, to seek healthcare. So please, if you're out there, seek healthcare early enough, not when you have any illness, even when you are healthy. Go and get your clean bill of health and walk out from the clinic happy.
All right, thank you so much. And let us remember that early detection can save lives, and there is hope for every child and fighting this battle. Thank you to our guest and Dr. Oz, and also for our viewers for tuning in. Remember, your health And your health and that of your children matters. Until next time, stay informed and stay healthy. I'm Ogom Ezedimbo.